Hello everyone, I am Rati Arum Listiandini. I am a Ph.D. candidate from the School of Psychology UNSW Sydney. And in this wonderful opportunity, I would like to present my research, which is cultural adaptation of an internet-delivered mindfulness program for university students in Indonesia. Let's talk about the psychological distress among university students. Psychological distress, which have the symptoms of depression, anxiety, and also stress, is found significantly higher among university students compared to the other young people. It is also increasing year by year and can have adverse effect on physical health, academic achievement, and general quality of life, and increased risk of developing later mental disorders. And the fact is that this stress occurred among university students around the globe, not only in Western countries, but also university students in Indonesia. Unfortunately, there are some barriers to access mental health services among Indonesians. The first one is the mental health gap, which is the lack and undistributed mental health professional compared to large and dispersed population in Indonesia. For example, in 2019, there are only about 700 psychiatrists and clinical psychologists for Indonesian populations, and the ratio is only 0.3 per 100,000 population, which is the ratio is very low compared to the expectation from WHO, which has the standard 3.3 per 100,000 populations. And half of these psychiatrists and also clinicians work in the capital city of Jakarta, and it creates a gap in treatment for people living in rural areas of Indonesia. Another problem that might be contributed to the low access of the evidence-based mental health services among Indonesians is the stigma and also shame related to the mental health problems. There are cultural beliefs that they who having mental health problems have demonic possessions, lack of faith, and punishment from God. Another barriers is the counseling fees and also the preference to talk with family and friends. And because of that, there are promising approach that could be handled that low access to the evidence-based mental health service, which is in here is internet-delivered interventions. There are some benefits of the internet-delivered interventions. The first one is it can enhance the accessibility of traditional treatment, flexible in usage, minimum of therapy time, so a larger number of patients can benefit. It is low cost, self-determined pace, and high level of anonymity and privacy. And it can also be presented in standardized content and easy translatability and cultural adaptability. And the clinical effectiveness of the internet-based interventions among students' populations has been proven for a wide range of mental health conditions, including for the psychological distress. And in Indonesia, more than 90% of university students are internet users, but studies about its effectiveness to help psychological conditions are still scarce. There are many of therapeutic approach that we can use for the internet-delivered interventions, but in this research, I'm going to use the mindfulness-based intervention as the main therapeutic approach. What is mindfulness? Mindfulness is awareness that emerges through paying attention on purpose in the present moment and observing ongoing stream of external and internal stimuli from physical sensations, thoughts, and emotion. So people who is mindful is people who are paying attention to the here and now and can understand and observe everything that happened, which is internal and also external, about their feelings, about their emotions, about their thoughts. And this kind of observations should be without judgment and as non-reactively and as open-heartedly as possible. And the mindfulness practice can include formal and informal practice. It has been proven to improve the psychological distress of university students, and it can be effective to be delivered by the internet. However, most of this research has been conducted in Western and high-income countries, and the efficacy of this program for university students and people in low middle-income countries such as Indonesia still warrant further research. And mindfulness itself also related with spiritual practice and religious values, which is important for many Indonesian. So this kind of approach might be suitable to be applied among Indonesian community. So the aim of the study, the first one is developing a culturally attuned internet-delivered mindfulness program for Indonesian university students. And the second one to investigating its feasibility and efficacy to alleviate distress among these populations. So in this research, I am adapting an Australian mindfulness program into Indonesian mindfulness program using systematic cultural adaptation framework from Barrera. The process starts from information gathering, preliminary design, preliminary testing, refinement, and adaptation trial. And what I've done right now is information gathering process. The first study for information gathering is online preference survey. In here, I conducted cross-sectional online survey among Indonesian university students. And the aim of the study was understanding the attitude and preference of internet-delivered intervention among Indonesian uni students. The data was taken during February 2020 using Qualtrics platform, and the participants is 245 university students with mean age 21.57 years old, with more female compared to male, and more undergraduate compared to postgraduate and research students. And most of them studying in Indonesia compared to overseas. And the items asked about the concern related to the mental health and well-being aspect among students, their openness toward internet-delivered mindfulness program, and the preference related to the program. And the second study is online end-user consultation. The aim of the study is to investigating the input and feedback from university students and also mental health experts about the program. The data was taken during March. The first step is FGD among students with 3 groups, consists of 4 undergrad students coming from private and public universities from various major of studies, psychology, engineering, economics and business, social science, and health science, and it represents different ethnic, gender, and religion background. And for the semi-structured interview, we conducted interview with 4 clinical psychologists and 2 mindfulness practitioners. There are 4 females and 2 males, and all is experienced using mindfulness practice for clients and for themselves. And this is the result of our first process of the information gathering process. So online preference survey, interview, and FGD with stakeholders give suggestion. The first one is about the delivery of the program. It is suggested that the program should be audiovisual format, guided with counselors or clinicians, and should be brief, only 3 until 4 sessions with only 15 until 20 minutes per sessions. The second one, they also give suggestion related to the clinical psychologist support or the clinician support, because the number of the mental health professionals in Indonesia is still limited. The suggestion itself is to give training to the non-experts, which is the lay counselors, to give support and also encouragement to the online interventions. And the second one is to give the step care model. So the first level of helping will be given by the lay counselor, but if there are any urgency coming, for example, like suicidal thoughts, the clients and participants can be referred to the clinical psychologist. And the third suggestion related to the content, which is in here, is to include the cultural and social context that need to be adjusted. And the fourth one is give example related to the mindfulness practice that can be practiced during everyday life. So the content of the online program that I am developing right now will include 3 main components. The first one is the psychoeducation component using audiovisual narrative story. The second one is the worksheet, and the third one is the mindfulness audio recording, so they can practice the mindfulness by themselves in their home. And this is the sample of the illustration that I will going to use in my program. So to summarize the significance and innovation of my project, this will be the first study to develop and evaluate the feasibility and efficacy of culturally attuned online mindfulness program in LMIC. And the research will follow more comprehensive systematic guideline, which not only include the language translation, but I also conducted preference survey, and also interview with stakeholders to develop the intervention that is to be more culturally relevant. The third one is give training to building capacity of lay counselors, which is it can contribute to the mental health system development. And the fourth one, hopefully it can reduce the mental health care related disparities and increase quality of life of young generation living at LMIC, especially in Indonesia. Thank you for listening my presentation. And this is the acknowledgement. Thanks to all my supervisor team, which is Associate Professor John Nubi, Professor Michelle Moltz, and Dr. Alison Mahani, and thanks to Indonesian Endowment Fund for Education, or LPDP, to fund my PhD here. Thank you very much.